that they
So we'll go live. Actually, we are already live. Just gonna give it a minute quickly. I'll just try here as well.
I have a dog that's being a menace here. She's in the lazy Susan now. I wish my husband would come down and do something, but hey.
Yes.
Okay.
Well, we just 1 minute and we'll go live quickly. Just make sure that Hello, welcome. This is Hassan, your member provincial parliament. Welcoming you tonight. Tonight we have distinguished guest. We'll be talking about Portuguese mental health addiction program. That was really a fantastic program, was working. We'll have more information, but before we begin, I wish to acknowledge at this time the land that we know as York South Western is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It is now home to many diverse First Nations, Inuit, and Métis peoples. Welcome again. This is Faisal Hassan. You're joining us live Instagram and Facebook, and my Facebook page and YouTube and Twitter, Faisal Hassan NDP. Thank you for joining me this evening for this important discussion. Recently, I was informed of the cancellation of the Portuguese language mental health services at the Toronto Western Hospital. These vital services were delivered through Portuguese mental health and addiction services serving the Greater Toronto area and also across the province. Most importantly, it provided that support in Portuguese, ensuring members of this hardworking community had access to treatment in their native language. This news immediately raised alarm bells. Stripping these services from the community at the best of times would be unacceptable. But to see it happen as Ontario is in the grips of a pandemic exhibits a disturbing lack of empathy and understanding for this community and the people struggling with mental health illness. This evening, I have invited leaders from the community to discuss the issue and bring attention to the gap created by this decision. Tonight, I have my colleague, Teresa Armstrong, Member Provincial Parliament for London-Fanshawe, and Cidalia Pereira, Supervisor Counselling Services Abrigo Centre, a centre that has done a fantastic job and have been contributing and serving Portuguese members of our community. And also Dr. Jose Silveira, Associate Professor, Department of Psychiatry, Faculty of Medicine, University of Toronto, and also worked as the Portuguese-speaking psychiatrist at the Toronto Western from 1999 to 2010, and was instrumental in clinics development. And this program, folks, have existed since 1999. It has served annually 1,000 patients. First, I would like to welcome Dr. Jose Silveira to give us a background exactly how this is started and the wonderful work this has brought into the community.
Thank you so much, and thank you for raising attention to this important issue. The community was given a great support by the Ministry of Health, the Ontario Ministry of Health, several decades ago. And with that assistance, we were able to put together a coordination of mental health and addiction services that were available in Toronto proper to develop a one-stop shop for mental health and addictions that was fully integrated. It was unusual in terms of its level of integration, but ostensibly more important is that it was built from the community up. That is to say, we spent an entire year, more than a year, reaching out to all providers in the community, community groups, church groups, services like Abrigo, St. Christopher's House at that time, is now our neighborhood house, I think. We reached out to naturopaths, to spiritualists, to absolutely everybody for two reasons. Number one, we wanted to provide a service that they needed. And number two, we wanted to let everybody know very clearly through our behavior that we wanted to be integrated within the community. Our approach responded to some very important issues in terms of access for non-English speaking, non-French speaking, or in other countries, non-native speaking persons who have immigrated. And one of those core issues is that there's a challenge at the best of times for people who are suffering symptoms related to a mental disorder or addiction to open up to others. And it is particularly difficult when people are language discordant and may not have a solid relationship with their primary care provider. So in those communities, very often individuals will use more available community informal services, so to speak. So one of the things that we did is we eliminated the typical barrier to access, which was requiring a referral from a family physician. We accepted referrals from absolutely anybody, including self-referrals. What we would do then is reconnect people to more formal services as required. But we wanted to take all of the barriers that existed and just eliminate them completely. With that, within 2 years, the services went from about 26 referrals per year of new consults to 500 new patients. And to put it in perspective, that's with one psychiatrist working with a group of very talented and very committed clinicians. And a typical psychiatrist in Toronto will see about 24 new patients per year. So to see 500, between 500 and 600 actually, new patients per year, that's new consults, new people, this is not visits, is striking. And we also, we wanted to make sure that we were successful in achieving that because our funding was contingent upon delivering service. And with that, we were successful in growing the clinic and continuing to be able to provide service and reaching out and providing additional services to nursing homes, for instance. The relationship with the Abrigo Center has been absolutely instrumental. Since approximately June of 2020, the UHN has shut down intake for the clinic. They are also not replacing the Portuguese-speaking psychiatrist that is leaving. And with that has resulted in a massive wait list. The wait list was created by the change in the model. The model works in a manner that to be able to serve that number of people is that clinicians are quite instrumental. The psychiatrist is important, but in some ways secondary. So, if my fingers in front of my face represent all of the clinicians, all of these clinicians are doing these assessments and following up with patients. And myself as the psychiatrist is providing support to the clinicians, providing support to the communities, doing core things that are required in terms of regulations, such as formal diagnoses, prescribing medication, but we all work as a whole. Now, if you reverse that order and you put the psychiatrist first and the clinicians back here, you've now created what the rest of the system has, which is a horrible bottleneck. And that's what happened. Then the wait list went up, and then the UHN said, well, the wait list is too high after they changed the model, and said, oh, well, now we're going to stop because it's not safe, which I don't understand. I've been chief of a department of psychiatry at St. Joseph's Health Center from 2009 to 2019. That doesn't make sense to me. It doesn't make sense to any other chief I've spoken to. So I hope that gives you a sense of the important need. The increase in the wait list that occurred with the change in the model reflects the need has not decreased. The psychiatrist that took over after my departure is also a trained geriatric psychiatrist. And that was with great fortune that she was recruited, because it follows the trajectory of the patient population as they age. Having said that, there's a very large number of new migrants who are Portuguese speaking from Brazil. And so the need has not decreased at all. And one last point, if I may.
Yep.
You know, one of the arguments that I have heard about the program, I do not know who is making this argument. One of the arguments is, well, why do the Portuguese speaking, Spanish speaking, Mandarin speaking, and Cantonese speaking populations, why do they get programs of this nature and not others? And my response to that is, these models, these services, these clinics were intended to be models for more clinics, not for less clinics. It's an unusual argument to make that we're going to eliminate services so that it's fair to everybody. That's not equity. Equity is, let's create services for that are similar, that have this high capacity with an enormous return on investment for the government, and give other people access.
Excellent. I mean, Dr. Jose, that was a very good point, because the answer is not cutting services, it's actually expanding and making sure that, those services work for the community. I know that the Cidalia at the Abrigo Center has done a lot of referrals and a lot of work in this. I would like to bring Cidalia to give us a background, the importance of these services that have existed and continued since 1999.
So the Portuguese Mental Health and Addiction Services has been around longer than Abrigo Center. They started off first before Abrigo was even created. And from when I started at Abrigo Center about 20 years ago, there's already a long-standing collaboration and partnership with the Portuguese Mental Health Services and Addictions in terms of referring clients, collaborating. At one time, we had staff coming on site to do on-site consultations with our clients, because we felt there was a high need and they're able to accommodate that and see clients there in our actual space, which was a great opportunity for clients and was able to make those connections. We've had a long-standing, a very successful partnership with them, referring clients for individual needs, as well as they have all for groups as well, which has also been a very successful project. When we learned the news that Dr. Scalco was leaving and that they weren't going to be replacing and going to fold it into the community services, and the impact that would have in restricting which clients would be able to access services. So seniors would no longer be eligible for the program. People not living within the catchment would no longer be eligible for the program. They'd have to go elsewhere. That during the time of COVID, where we're talking to seniors and adults, where the stress and the fatigue of dealing with the pandemic, not being able to socialize, losing their jobs, grieving the sickness and death of family members, whether here or whether overseas, has increased the calls to Abrigo and put their mental health in jeopardy, their mental well-being. Not being able to access those services has had quite an impact. We've had very successful clients with suicidal thoughts, clients with diagnosis of mental health that get services, get diagnosis, get medications, become stable. We know that they're connected, that they can go back when they're in crisis, that they deserve, that they need. So it's been a very important service for the community. Now we're receiving calls about doing mental health counseling that we cannot take those kind of requests on. That's not our area of expertise. We're not experienced in that. That's not something we can provide. So we're looking to where can we refer these clients so that they can get the supports they need, whether they're in crisis, whether they're talking about suicide, where they're stopped taking their medications and have become aggressive. We're talking about the family members dealing with this. We're also talking about addictions and substance use, because they do have an addictions counselor who's been working with our community to work on harm reduction policies and other things to help people have better opportunities in life and have better quality of life. All those services are having an impact. And I must, I have to thank the staff there at UHN, Portuguese Mental Health Services, for all their hard work, because they've always been very compassionate with us, very giving of their time, providing training to us, consulting with us, collaborating with us. So not having that access, not having those services to refer to, it's a sad day for us at Abrigo, and I think it's sad for our community that so much needs this service. Especially, our community isn't small, it's large. I know we might be talking about older adults who might be aging out, but that's even more important for them, because as they age, we know that immigrants tend to lose their secondary language. So they learn English, they forget their English and go back to their native language. And that service won't be available at UHN anymore. And also the newcomers that come, and they come through different methods. We were talking about Portugal, whether we're talking about Brazil, the bulk of that. We also have people from other Portuguese-speaking languages that are coming through, and also needing to access. And newcomers now that have lost their jobs, have family in Brazil or Portugal that have passed away due to COVID, and they're dealing with grieving and not being able to grieve in the normal ways. And they're needing those support. Sometimes it's short-term support, sometimes it's going to be longer-term support. There's only so much that we at Abrigo can do, and we're already sort of stretched to the limits of our mandate, which tends to be violence against women, senior support, youth support, those and social service type programs. We don't have the capacity for the mental health, which is very needs resource right now.
Exactly, and also this program has already existed. It was part of the address. All it needed is to continue and also to incorporate into the system. So if a psychiatrist retires, then another psychiatrist takes over. But I think the answer is not cutting services that is working for our community. And this is unacceptable. We want it to be restored immediately and to continue services that are working in the community. I'll bring my colleague, Teresa Armstrong, who has also the distinction of being the first woman elected as a first Portuguese Canadian elected in the Ontario legislature, and who is also my colleague. I want you to thank you first for joining us tonight. And I know this program was across the province. It has benefited so many members, and the Portuguese community live every part of Ontario. And that is also the greatness of our province. And also a program like this is very important that we support it. And I give it the floor to you, Teresa.
Thank you, Faisal. And I want to say how important it is that we are meeting today and bringing these issues to the virtual world and getting it out there so that people understand what's really happening in the community, because there's so many things right now at play, and every day there's a new news conference, there's a new item, there's a new variant. The toll of that this is having on our mental health, on everyday life is extreme with what we're experiencing. So coming together and discussing what's happening now on the ground when it comes to realities of services that are being offered to the Portuguese community, and knowing that these are being phased out, it's putting people probably in more distress, right? Because as Jose mentioned, taking barriers away from services, people will access them. And once you start putting, challenges or hurdles in front of people, they don't know how to navigate that. And then we actually end up having more issues in society, right? In our homes, in the workplace. So I want to thank you all today for being here, and thank you for the audience who are joining us today. And as I had said, the pandemic has taken a toll of all of us in Ontario, and there's been study after study that's shown that how our mental health as a province has really been affected. I mean, there's the CMHA has done a study just recently, another poll, and the numbers are up. People are in mental distress, right? It's a contributing factor. It's something that we have to deal with. And there's been a shocking increase in, substance abuse as well. People are at home all the time, and we know that people are turning to alcohol and marijuana and opioids as a way of dealing with the stress. And so we also know that the child and adolescent eating disorders are at all-time high levels. Significant numbers of healthcare workers are reporting traumatic symptoms, stress symptoms. Increasing numbers of people are reporting symptoms of anxiety and depression, although we haven't seen how that is translating into the increased demand for services because, again, people are at home, right? And there's a long history of underfunding mental health services in Ontario and in Canada. I mean, I've been fighting for many years about mental health here in the London-Fanshawe area. London Health Sciences was one of the hospitals that were bursting at the seams when it came to services for mental health. And we fought, very hard to make it acknowledged because it's one of those health care illnesses that people don't talk about a lot, right? And there's a stigma around that. And we did get a mental health clinic, a walk-in clinic on Huron Street, but within a month of that opening, again, it was over capacity because people are becoming more aware of what the wellness piece means, and they need to have that mental health service to access, whether it's a crisis and they just need maybe a couple, sessions of counseling, or whether it's long-term. So to hear news that the center, the psychiatry services that are offered in Portuguese to the Portuguese population are being cut after, since 1999. And as Jose said, the evidence-based was that it was growing and that there is a need for that. And for the government not to recognize that those services are vital for the health and well-being of people in our province, in people in Toronto. We have a very diverse, as we always say, diverse province. And Toronto is one of probably the most diverse cities. And instead of taking that model and branching out and bringing other services in different languages and making it more diverse and having less barriers, they're doing the opposite. And it comes really as a shock as to why they would do it in the sense of the model, the way that was described, start eroding the clinicians, putting the pressure on the psychiatrists and setting it up for failure. And that is not acceptable. I have a personal experience. As I said, I was born in Portugal, came here with my parents, 5 of us, as a matter of fact. I had 4, my sister, myself, and my 2 brothers. My 3 brothers. The little one was just a baby, Carlos. But we came with 5 kids and my mom and dad. And then my mom had another child, another son. So I grew up in a family of 6. And, what I had found from experience was even when my parents accessed health care services or any kind of government services or business dealings, they would need one of us to go with them to translate, and one of the things that was very important to our family is I had a family member who needed mental health services and for years and years. And now I'm in London, and as you said, at some point, everyone was able to access those services throughout Ontario. But I can tell you that the difference it would have made if my family member was able to speak to someone in their own language would have been far better outcomes. So my story is just one story, but it lasted for decades, and it got worse. And if there was access to someone who could communicate with that family member in their own Portuguese language, I know that would have been such a consolation to that person, and that peace of mind that they're actually being heard. But when you have your daughter, speaking to that psychiatrist with you, then that's something also we have to remember, that the child was bearing that information, which really shouldn't have been, right, at that young age. And then there's also the stigma of, pride, right? Parents, like immigrants come here to Canada. I can speak for, my family. There was a lot of pride. And, to bring your child into a healthcare session where they're the ones, doing the talking for you, that wasn't a good experience. So it is so important that we do fight to keep this service relevant and continue to have it. And I'm so glad that Faisal and Jose and Cidalia are here to bring this issue to light so that we can pressure the government into changing its course.
Absolutely. And the government is wrong in this case because you don't cut services and programs that are working for the people.
That's
You
right.
expand it, you also take it lessons learned, you improve it, but you don't just shut it down. I mean, I know that Teresa, you talked about, and even Dr. Jose and Cidalia can talk about it. The Portuguese service, did it help to reduce stigma of the mental illness in the Portuguese community as well? Because there's a lot of stigma in mental health. When someone could have someone who could actually speak to their own language, provide services, and also they have been talked about, and there's a lot of studies about translators. When the translators are not psychiatrists, the entire information is not captured. So you have to have a psychiatrist and the patient. You don't want anyone in between them, And I think it's very important. Maybe Dr. Jose, if you could talk about that, since you also worked in the program, did it help to reduce the stigma of the mental illness among those members of the Portuguese community? Now they feel there is a program and services. There's a psychiatrist who could speak to the language, and there are other support services such as Abrigo Center and others, trying to make sure people are supported.
That's a great question. It's an important point, as Ms. Armstrong pointed out. The issue of stigma is substantial. I wish I had numbers, right? I wish I had numbers of what happened in the community over time in respect to stigma. And unfortunately, I don't have numbers, but what I do have is an example of how much more mainstream the service became over its history, to the extent that an organization called Academia de Bacalhau, which has international roots, but extends into a number of different countries, recognized the clinic, I think it was in 2008 or 2009, for its contribution to the health of Portuguese-speaking communities. And, that was a very public procedure and recognition that involved a large gathering. Thank God at that time we were able to get together. So that was significant for several reasons, most notably the fact that it was public and that mental health, that means mental health was on people's lips. In respect to how mainstream this became, there was fundraising for Portuguese mental health and addictions. We had community organizations that would invite us to speak. Again, these are social events, religious events, and other types of events, and who previously would not have entertained the possibility of someone coming to speak. I had the pleasure of speaking at numerous events. The media gave us attention. We were on the radio, we were on the TV, and that had not happened before. I think that when you provide a good service and people start getting better and improving, all of a sudden it becomes like any other condition, because in the absence of effective treatment, and if you're trying to provide treatment of a condition that has no objective measures associated with it, there's no chest X-ray, there's no blood work that you can do, then you are dependent on the individual who is experiencing the phenomena and on their family to provide you information. So it would be no wonder that people would languish for years and decades, symptomatic, unwell. I recall one poor family who brought in a family member who was literally in a state of vegetation, who they'd been cleaning in bed for months. And this would never happen. They just had nowhere to go. And that gentleman went from being effectively in a vegetative state to returning to work, which was just incredible. It was just incredible. And so having outcomes of that nature again and again and again helps to reduce the stigma, because part of the stigma comes from fear. And the fear comes from things that we don't understand. So we make it understandable, and fear that it is permanent. And then making it clearly mutable, i.e., no, people get better, really makes a difference. So that's an excellent point in terms of whether or not this translated into improved or reduced stigma. And I think the access point and going out and connecting with the community again and again, and it wasn't just during that first year and a bit, that first year and a bit gave us tendrils, connections, very strong connections, conduits to the community that we learned from and we were able to leverage. And we depended on that in order to be able to provide the service.
Very good. Well, thank you very much. And I think those who are joining us, you're joining us live. Faisal Hassan, NDP. We'll try to include your comments and questions and observations. We'll try to do that. And thank you for joining us. So we are talking about the Portuguese mental health and addiction services that have existed since 1999 and have really done a fantastic work and supported members of our community. But unfortunately now this current government wants to end it. This is the wrong decision. The community wants this program to continue, and that's why we are tonight talking about to raise the issues and also bring the face and also to the thousands and thousands of people who have benefited this program since 1999. And when something is working for our community, you don't just eliminate it, you don't just cancel it, you don't do that. You continue to support the community, and you also do the evaluations. This program is actually exceeding beyond what was originally designed, and it is the programs like this that we want to continue. And I know that it was originally, as Cidalia talked about, across the province. People were referred everywhere in the province, and now they're trying to eliminate that and say they're going to limit it at the beginning, and now they want to all eliminate it. This is unacceptable. Maybe Cidalia, could you talk about it? You know, those folks, far away places, you know, everywhere in Ontario, accessing to this services.
We'll sort of pick up on a point that talked about stigma. The ability to be able to talk to clients now about their mental health and well-being has greatly improved over these last couple of decades, in part due to the work of the clinic going outreaching and creating those relationships with doctors, and also as counselors, us talking to them about what is mental health and try to make those connections. What we're seeing is a core people living in Toronto, and those core people, that population is moving out, just like the other immigrants before them. They're moving out of Toronto, going to Oakville, Mississauga, Barrie, you name it. And sometimes it's the children who move out to raise their families, and their parents go to join them. And now they're no longer living in the GTA, they're outside of the GTA, but mental health exists everywhere across Toronto, Canada, the world. So people still have mental health needs. Now it becomes, if you only speak English, have poor So if you only speak Portuguese and have limited English, or if you're a senior now living with your adult children outside of Toronto, where are you going for services? We used to be able to speak to them because we do get a lot of clients outside of Toronto and talk to them about their mental health and well-being, whether we're talking about depression, anxiety, or other mental health issues, what symptoms are they displaying, talking to their doctor about getting that referral to the clinic, and then that would happen and they'd be connected. And we'd be very happy that they had that connection. They would get their diagnosis, a treatment plan. They'd come back for some ongoing support or for other needs that the clinicians couldn't take care of. Be great. Nowadays, when people come to us and say, well, I need mental health services. Okay, where do you live? You're not within the catchment area that currently is operated by the hospital. I don't know where to send you. You need to speak to your doctor, and you're likely going to go to a local community mental health clinic, which may not have, probably will not have, a Portuguese speaking clinician. And as mentioned before, the ability to speak to someone in your own language, your first language, is very important. When you break a bone, it's very obvious what the problem is. When you have a mental health issue, when you've experienced trauma, that is a challenge to be able to open up and talk to someone about that. I can give various examples of how the program has been successful, but I'm going to talk about one client that I have who has limited English skills, is seeing an English-speaking psychiatrist. I've been asked to interpret or translate during these sessions. So what would normally be a 45-minute session go well past an hour because you're using an interpreter. And it's because I have a relationship with this person that she's able to open up and share about family history of mental health, childhood trauma and abuse, her symptoms of depression and anxiety that otherwise would take it much longer for the psychiatrist to know about and try to figure out what is a good treatment plan for her, and be following up to see how is she doing and providing that ongoing support. It's taking a much longer time for the psychiatrist to do it. She's doing her very best, so kudos to her, but it is more of a challenge. It is more harder. I have another client who has severe schizophrenia. She was seeing an English-speaking psychiatrist who could only provide limited services. We were able to connect her to Portuguese mental health. She had the psychiatrist support. She had a clinician and an outreach worker that would go in and check on her to make sure that her hygiene was okay. She was keeping up her doctor's visit and getting her medication done. She was making sure her bills were paid on time. Things that I didn't have the scope and capacity to do, because when she would disappear for months at a time and she'd come back and say, yeah, I had a problem. I was hospitalized. And I'd be like, what happened? What ended up with you? And I couldn't follow up with those kinds of issues. So I see the positive impact this has had. So now without that service, I'm just worried about how people will access, because now there'll be more barriers. There's more of a need. Now there'll be more barriers for people to access service and access a good standard of care in their first language might not be possible. So I just worry about what's going to happen to those clients.
Yes,
And how
yes,
we can
Teresa,
support.
yeah.
Sorry, I just wanted to make a comment after Cidalia was done speaking was, where was the consultation with the community? I think that's something that should be done when you are going to take away very unique services that obviously are put in place to serve a need. And then just to take that away without the community being aware of it, and also having the community voices heard as to why it's important. Because sometimes I think the people who are making the decisions at the top don't understand the effect it has on the ground. And yes, you two are professionals. You're speaking about how important it is, but the people that were accessing those services, the people that are making the decisions about cutting the psychiatry for Portuguese speaking languages, they need to understand the benefits and how that's going to affect them now. And as Cidalia talked about, some of the effects of how you're going to, provide the woman who has schizophrenia and the extra services that went above and beyond because of that language connection. But, there's no community consultation. You just read it in the paper. And then I understand that they stopped taking referrals in June, was it? In June. And they're phasing it out. What month? It's just coming up, isn't it? When is it being phased out entirely?
Well,
I
that
believe
is
June of this year.
This year, June. July of last year, they stopped taking referrals, wasn't it? Excuse me. And then as of June of this year, it's now going to be completely canceled. That is not enough time for the community to react.
Yeah.
And during a pandemic on top of that, there's more of an obstacle for people to go and explain or be heard as to why this service needs to happen. And these models need to be expanded out into the communities, integrated into partnerships of centers, of community centers where there's different languages being spoken. I mean, we talk about, I'm going to just quickly talk about long-term care because I had that portfolio before, and there's a lot of people in long-term care who need that linguistic help. And so, to take away that type of service out of the community without thinking to the future and what the long-term effects are going to be in the community is very short-sighted and quite cruel. As a matter of fact, if I could say that, it is quite cruel when you don't talk to the people that you're just deciding what's best for them without consulting them.
Exactly, and that is unacceptable because if a program like this is just being eliminated like this, then what else is to come? This is a program that was working for the community. Fantastic. This has been a model program, and I just want to ask now, the range of disorders was treated, and also what is being taken away more specifically. And I know that Cidalia have talked a bit about that, but maybe Dr. Jose can talk about that because we want people to know these services, the impact it would have, and all these disorders that has been treated and now taken away. What are they specifically?
Well, that's a great question, and I'm so happy to be able to respond to that. This was a fully integrated community general psychiatry program that was integrated with addictions. So which is unusual. First of all, we had no exclusion criteria whatsoever. The only things that we took into account were issues where we did not have medical legal expertise to get involved in terms of disputes in court, things of that nature. But even in respect to cases of not criminally responsible, i.e., what many people often hear of as the defense by reason of insanity, it's referred to formally as not criminally responsible. We got involved in those cases as well. We were asked to assist in those cases. So we did everything from common mental disorders, including mood disorders and anxiety disorders, schizophrenia, patients that required special treatment, special medications for schizophrenia, dementia, various types of dementia, including Lewy body variant dementia. We would see adolescents. We even saw children at times when they were newcomers and Portuguese language dependent. So we did not turn anybody away. And in terms of addictions, the only thing that we didn't do was provide opioid replacement treatment. Otherwise, our addiction services were across the board, including gambling. When funding became available for gambling, we had a clinician that was trained, and we began to see patients who had behavioral addictions, including gambling. To give you a sense of how much this clinic was used throughout the hospital systems, including through CAMH, the Center for Addiction and Mental Health would reach out to us to provide services to the Portuguese-speaking community. Center for Addiction and Mental Health was instrumental. They worked with us to create the first 21-day residential treatment program for alcohol use disorders in the Portuguese language, and that was culturally competent. It was, they were an incredible organization with us. Many reasons not to partner, with us. We're small relative to an organization like CAMH, but that is the extent of it. We were everywhere that mental health needed to be, including, as I said before, long-term care facilities, connections with school, connections with probations and parole, connections with inpatient hospital services across the city, not only UHN, but other places. I dare say that I would be surprised if there's any other ambulatory service that would be able to claim what we provided and the numbers that we served. So when I said earlier, the return on investment, if I was to look at this through a funding lens, the return on investment for that is just it's unparalleled. I want to also make a point that the government has, and I think Christine Elliott's office has pointed out that this is up to the hospital to deal with this. Now, I doubt that we would get the same response if it was a surgical program, if it was a gamma knife program at UHN, if it was an oncology program. Now, this is not to say that all of those programs should be at risk. Absolutely, they should not be at risk. But there is still a degree of stigma that is not that comes out in the manner that is a differential treatment of even services for mental health and addictions. UHN has repeatedly said that they are not closing the service. This is their official line, that they are not reducing the service. But they've started this process in June of 2019. In an internal email that was cited by the journalist in the Toronto Star, Nadine Yusuf, this process has been going on for 2 years, over 2 years. And in your question, Ms. Armstrong, in respect to the communication and community consultation, they did not send out a single notice, not even to family physicians that they were discharging patients to, until we began to make some noise. Until that, there's certainly been no community consultation whatsoever. I'll let Cidalia speak to that in terms of whether or not Abrigo, as a core partner, where it was ever communicated with. The patients haven't been informed. The family physicians have not been informed. The only way that the family physicians realized something was happening is that patients were being discharged back to them without a word. And they had done this already with the Spanish-speaking program, where the first that a family physician would hear that the program had been closed, the Spanish-speaking program closed, was patients showing up on their door having nowhere to go. And that's how the family physicians learned about this. So, to take a program that is really a model in terms of community mental health and addictions, and to eliminate it essentially, because it will not provide the service that it has been, and it has an enormous impact. And without one iota, I have been on several calls already with the leaders from UHN. I have asked for numbers. They have not been able to give me one single piece of data. Not one single piece of data. It's mind-boggling. It's mind-boggling. This is University Health Network, the largest academic health science center in Canada.
It's unacceptable. And I'll bring, I know that this current government have been cutting a lot of services. We've seen their budget, but programs like this that is really supporting the community, that has really Dr. Jose and also Abrigo Center and many members of the community have stated. I think we need to say something about this, Teresa. I mean, isn't it an important to intervene on behalf of the community now?
Well, I mean, under the conditions that we're in COVID, and to continue bulldozing and canceling the program is just so wrong-headed. And when Dr. Jose, I totally agree with you. They weren't notifying primary caregivers. They weren't notifying partners. They weren't notifying their patients. And then they weren't even giving, evidence-based reasons why it's not a successful program. Whereas you can speak to the success of the program from both your perspective for Cidalia and yourselves. It really leaves us questioning where this government is headed when it comes to mental health. Mental health services right now, we know, are at the peak of because of COVID. And having it a specialized service for Portuguese speaking people, then it needs to continue and grow. And the fact that there isn't any transparency around why is disturbing. I'll be honest with you. That really concerns me, because they should be able to justify why they're doing that. And if that isn't something that's transparent and they're not being held accountable, then what is next? What can be done in the dark of the pandemic? And when I say, community consultation, it's even more difficult to hear people's voices, professionals or, doctors or experts or people who are receiving those services. So to have those kinds of management decisions happen in the way that they've been rolling out, it's completely wrong, and it shouldn't be happening. It should be paused. It should be paused, and you should be getting answers as to why this program is failing, and you want those numbers because you've put your heart and soul into this program. It's been successful since 1999.
Exactly.
And you talked about wait lists, right? You're going to have people turn people away, and where are they going to go? There's wait lists in London for psychiatrists.
And exactly, and if the government, especially the Ministry of Health, cannot tell us, program like this that is really working very well, and there is numbers in it, and it's very successful, and simply to not continue, it makes no sense at all. And we need to be reinstated and do the right thing, and to continue serving the community. I think that's the right thing to do. I think Minister Elliott and the entire ministry team should immediately do the right thing and reinstate quickly, and also assign other psychiatrists, and the program should be observed into the University Health Network that is already being in part of that. And if that specific hospital is not hosting it, then another hospital, another space should be found, but it must continue, I know we're coming to the closing. I know that this is very important to the community. And where else are they going to go now if this program is eliminated? What option? What else is out there for them? There's nothing.
Cidalia, I'll let you respond.
We actually tried to do a bit of an environmental scan to see what's out there. So I reached out to partners in social service agencies, community health centers, and so forth. So basically the response was, well, we referred to Abrigo, we referred to the family doctor, and then there isn't much of anything else. The one or two clinicians who aren't outside of UHN that speak Portuguese already have wait lists. So in reality, there isn't anywhere to go other than English speaking, so that have their own eligibility criteria and also wait lists. And then the issue of the barrier of language, which is a difficulty already for our clients to overcome.
That's unacceptable.
And I think also the part of the whole equation that we're forgetting is, when you cancel this program, how do you follow the people that were benefiting from that program, and what services were there to replace that, right? And how did that affect their health overall? And so we lose touch when we cancel programs, and we don't do our due diligence and follow up with those patients and find out how successful they were to continue their treatment, how successful they were to continue to access services. And so, but I say that in tongue in cheek because they probably don't want to know those answers, because if they did know those answers, they would have jeopardized those people who were accessing those programs successfully. And now they've lost them in, the big scheme of things. And nobody knows what happened, other than the answer would be, well, we saved $1 million. The program wasn't working. Well, that really serves the purpose and their narrative of why they're canceling it. It doesn't serve the people that were actually using that program, both professionally operating it and the people, the Portuguese Canadians, the Portuguese population that needed those services in their language.
Jose,
Yeah, one of the points I was going to make, Mr. Hassan, you talked earlier about the responsibility of the government and power in respect to this. And, there's a back and forth between UHN and the government in terms of who is accountable. But in leadership role at St. Joe's in a general hospital in Toronto, the government was never shy to make us accountable for wait lists and the number of hours that a person was waiting in an emergency department for service, time to first assessment, length of stay of beds, readmission rates for patients with COPD, etc. So it seems to be a very convenient response to say that we leave this up to the hospital in one area, but be so vigilant in respect to what is happening on a day-to-day basis in a hospital in other areas. So I hold both equally accountable in this case, and the program is, as far as I know, still funded by a special envelope through the government, and so the government is holding the key to the safe where the money is coming from. So in the end, they must be accountable for what is happening there. And as you pointed out, Mr. Hassan, if the UHN as a general hospital is choosing to go in a different direction, they are no longer interested in mental health and addictions. They don't think it's important. They don't think that equity in services is important, because they'll be saying no to both of those. They'll be saying no to mental health and addictions, and they'll be saying no to equity in terms of services. Then, as you pointed out, Mr. Hassan, give the envelope of dollars to another organization, to another hospital, to people who do recognize the importance of equity, who do recognize the importance of mental health and addictions. Let them take it on.
exactly. I think that's very important. I think that is the solution, basically. Absolutely. And I know that I'll just give you another points of conclusion or concluding remarks. Maybe I'll start, Cidalia.
I want to thank you for the opportunity to be here with all of these great presenters and be able to bring this topic to light and share this with the community, both the Portuguese speaking and the mainstream community, about the importance of mental health, being able to access services in your first language, and that, especially at the time of COVID, that we all have to look after our mental health and well-being, and the need for services, whether we're offering service through Toronto Western UHN or through another avenue, that these services should continue, should exist. We have a great team there at at Toronto Western that was providing services. We'll have much reduced contact with them, unfortunately, now, but it was a great service, and hopefully we can help have it continue in some other way, shape, or form.
Excellent.
Thank you.
And Teresa?
I just, I want to thank you for raising this issue, and both the panelists that were here as well tonight. We talked passionately of how important it is to have these diverse services and the impacts that you did provide to people's lives in different sectors, variables. And as you said, you holding up this model, and you challenge any other model of the kind of diverse, diverse services that you provided when it comes to psychiatry. So I I only say that the government should do a rethink when it comes to services in Portuguese for psychiatry for Toronto area. This is a needed service. It's something that's proven that evidence-based is successful, and not to have a transparent process so you can have consultation and contributions made so that people can explain the validity of this and the value that it's provided is shameful. And so I ask, if anybody's listening out there from the government, that you go speak to the Minister of Health and you make them accountable as to why this isn't going to have a continuance of funding in a home somewhere else. If the issue is that the university hospital network doesn't want to host it for whatever reasons, yes, look for a new home, because mental health services are needed in Portuguese. And as this government has been saying, is that they're investing in mental health. Well, they need to continue this investment. This is doing a backflip on what you've actually been saying in the legislature and funding mental health. This needs to remain as a Portuguese service for the citizens in the Toronto area.
Very good. And Jose, the last point, remarks?
I just want to say thank you, Mr. Hassan. Thank you, Ms. Armstrong. Thank you to the NDP, because you are now it's now a count of 3, starting with Merit Stiles of the NDP. I don't see any other party coming forward. So thank you. Thank you for continuing to pay attention to this issue.
Well, thank you for joining us on this important discussion on Portuguese mental health and addiction services. I want to thank my guests for joining me and sharing their knowledge and experience with us tonight. MPP Teresa Armstrong from London-Fanshawe, thank you. And also Cidalia Pereira, Supervisor, Counseling Services, Abrigo Center, thank you. And Dr. Jose Silveira, Associate Professor, Department of Psychiatry, Faculty of Medicine, University of Toronto. He also worked as the Portuguese-speaking psychiatrist at the Toronto West End from 1999 to 2010 and was instrumental in the clinic's development. We thank you for joining me as well. This pandemic has shown us just how important mental health is to an individual's overall being. As more and more people look for support, the government must ensure that mental health services are accessible and well funded. I hope tonight's discussion also highlights the imperative of ensuring that these services are available in person's native language. Portuguese speakers struggling with mental illness deserves the comfort of knowing that they can have intimate and emotional discussions with mental health professionals in a language they are comfortable with. Our Portuguese community in York Southwestern continues to grow, including from diverse countries such as Brazil and Angola. I'm committed to ensuring this community has this vital service restored. The Portuguese community worked too hard to develop these resources, only to see it taken away from them when they need it most. I know I can. I can count on your support as we tackle this problem together. Tonight, those of you who have joined us live, Instagram, YouTube, and Twitter, and Faisal Hassan NDP page, thank you. And I know that, I guess my colleague Teresa, do you still do the Fridays coffee time?
Yeah, I think you adopted that model. Yeah, so with the new virtual reality, we hold once a week coffee hour with an MPP. And so this week I won't be able to, but we'll be continuing next week. And that's an opportunity again for people to reach out to us and hear their concerns and what their sometimes solutions, solving problems, and then sometimes, of course, asking for assistance in any way we can help, we do.
Well, you can join my colleague Teresa Armstrong next Friday. Bring your coffee and tea, and you can also join me this Saturday, and we can talk about the important issues of the week. Until then, thank you and good night.